Hello, everyone. My name is Beenish Mahmood, and I'm here once again to interview Dr. Pari. Just to let you know about myself, I'm from Moms.Ca portal. Moms.Ca is a community portal in which women from all across Canada come together to share ideas and information. Iram Zahra is our founder, and I write blogs and do interviews. Today I have with me Dr. Pari. Dr. Pari, hello, how are you?
Yes. Hi, Beenish. Hi. Thank you so much for your time today. And thank you to Muslim moms and also Iram. I've been part of the community for the last few years, I believe, maybe since the beginning that the community started. Because I live in Mississauga for the last 6 years.
Mm-hmm.
And it's really a great community. It gives us the opportunity to connect with other ladies and,
True. Yeah,
discuss what's going on in our lives. If someone has an issue, others pitch in to help. And there's
that's
always,
right.
informational topics there that everybody can take advantage of and learn about new things. So thank you so much. And thank you for your time today.
Thank you so much for joining us, Dr. Pari. Now, I'll give you a brief introduction about Dr. Pari. Dr. Pari is an internationally trained doctor and a business executive with over 20 years' experience in healthcare. She's the co-founder of Elan Health Care, which is focused on reproductive health. She immigrated to Canada in 2014, and she lives with her husband and son in Mississauga. She also volunteers at RISE and My Women's Support, acting as a mentor and advisor to underprivileged women and youth to help them start and grow small businesses. Now, Dr. Pari, I'm just going to ask you questions on the topic infertility and PCOS, and so our community is
Yes,
more
sure.
aware of it. So just tell us
Definitely.
about more about yourself, Dr. Pari. Walk us through the journey that led you to Elan Healthcare.
Thank you. Well, I think you did a very good introduction. I
Mm-hmm.
started my career as a medical doctor, and I practiced for a few years, 4 or 5 years, and then very much by chance, I got introduced to the pharmaceutical industry. And when I went into the industry, I got more and more interested about how the research and development and product formulation works and how new products are brought into the market and what are the stages. So while I was working with a big pharmaceutical back
Mm-hmm.
home,
Mm-hmm.
I moved from different sections. So I started off as a medical advisor, but then I get a chance to experience marketing, sales, product research, product launch, all the different aspects that work in a pharmaceutical.
Okay,
And
perfect.
one of my dreams always was to be able to have a product line of my own, but it was
Mm-hmm.
sort of like a distant dream that I like to have, but I didn't really think I was able to achieve it until
Mm-hmm.
I came to Canada and I started working in a smaller company. And I realized that the business environment in Canada is somehow much more friendlier to small business. And there's lots of support both in the community and from the government that
That's
help
right.
people that have an idea
True.
make that into a venture and get it out to the community at large. So
Mm-hmm.
during my practice and also my work in pharmaceuticals, I encountered a lot of women and families that had infertility issues. PCOS, polycystic ovarian syndrome, was a very hot topic, but it
Mm-hmm.
was always, I considered it something that was underdiagnosed and undertreated.
Mm-hmm.
And so I'd done a lot of research about it, and I thought that if we can go towards a more natural approach for managing the symptoms, because there's no treatment as per today, there is no treatment. It's more the management. So if we can find a more natural approach without all the harmful chemicals, maybe that's a better solution for many women that are suffering from this. So that's how the idea came to mind, and I started off this venture, Elan Health Care, with a colleague of mine that he has a PhD in chemistry and he's an expert in product formulation. So I had the scientific research and medical background and also the business experience, having done an MBA back home and also business management in Canada, that we thought, okay, well, let's start this and see what comes out of it. So it took a
That's
very long
wonderful.
time, a lot of research, a lot of testing, but
Obviously, yeah, yeah.
thankfully in the last year, we were able to get out 3 of our products to the market, and we're doing well.
That's
Alhamdulillah.
wonderful to hear. That's wonderful. So where is Elan Healthcare located, and what are the main services that you offer?
Yeah, we're based in Mississauga, Ontario.
Okay.
We have 3 products that are for reproductive health, and they are natural health supplements. So
Okay.
they're all supplements that are registered with Health Canada, and our manufacturing is done in Mississauga.
Mm-hmm.
Some of it is done in London, Ontario, but it's all contained within Canada.
Okay.
We source our ingredients internationally from the best sources that we can find. Sometimes
Mm-hmm.
that specific ingredient is not available in
Mm-hmm.
Canada, but personally, as a small business, I rather prefer other local small businesses, so I try to keep to Mississauga as much as possible.
That's great to hear. Dr. Pari, can you just briefly tell me what is PCOS for some of us who might not be aware, and what are the main symptoms?
Yes, sure. I'd like to share a little, I'll share my screen, and I'd like to share a little visual of this so it's easier. And
Sure. Sure.
um, if you give me a moment, please. Okay,
Yes.
okay. So you can see this, Beenish?
Yes, I can. Yes.
So to say it very simply, PCOS or polycystic ovarian syndrome is a common endocrine disorder. Many women have this. In fact, 1 in 10 women have PCOS. And there's estimated about 5 to 6 million people in women in North
Mm-hmm.
America that have PCOS.
Okay.
So it has a variety of symptoms, starting from maybe the most common that most women would have heard of is that they have irregular menses, but it just doesn't, or they have cyst on their ovary, because that's the name, PCOS, PCOS, or PCOS, like
Mm-hmm.
polycystic ovarian syndrome. But it's not just that, it's a lot of different aspects and hormonal imbalances that affects their mood. It causes acne, it causes infertility issues, it causes difficulty in sleeping and fatigue. Insulin resistance is a very important factor, and higher testosterone levels, lower progesterone levels. So overall, it's a condition that affects all body parts. It may start as a cyst on the ovary, but it's more like a systemic condition,
Mm-hmm.
and that's why it can be so debilitating, because it's many people, like, a lot of attention is paid to, for example, breast cancer, but this is a lifelong condition that affects each and every aspect of a person's life. And it may be it doesn't cause mortality, but there's a lot of decrease in quality of life and a lot of other health conditions that are basically linked to it.
Okay, that's good to hear. So, like, at what age exactly can polycystic ovarian syndrome, at what age can it be diagnosed?
Yeah, the diagnosis is it can be very early from the teens. If like a young lady, even 14, 15 years old,
Mm-hmm.
experiences irregular menses
Okay.
and pain, a lot of pain before their period, they may go to their doctor, and the doctor may basically give the diagnosis for this.
Mm-hmm.
But um, the issue is that a lot of cases are not diagnosed early, and
Okay.
many women just suffer from this until a time that it comes to a breaking point. And that's where either they have a cystic rupture and they're taken to the emergency room, or they get married and they can't conceive. Then they're going to the doctor to see what's going on. So they always had irregular menses but never paid a lot of attention. So in many cases, it takes years and years before it's really diagnosed and any kind of treatment is started for it.
Okay, so what treatment do you offer, Dr. Pari, at Elan Healthcare for the polycystic ovarian syndrome?
Yeah. So overall, to manage PCOS, because again, I said we don't treat, it's a management of the symptoms.
Okay.
There are lots of different solutions out there that are advised. Of course, having a healthy weight, eating healthy, limiting carbs, and having a regular exercise regimen is very important. And then there's birth control, there's like spironolactone, metformin, all the medications. What we offer in Elan Healthcare is a natural supplement. Uh, and that is ovofolic. Ovofolic is a combination of myoinositol and dikairoinositol. And these are basically polysaccharides that are found in the body and with a ratio, and in our formula, it's in a ratio of 40 to 1. And why is that because this is the ratio that's proven to have the most beneficial effects in the body. So it's found in the body, it's found in a lot of food, but in women in PCOS, they have realized that these women have less concentrations of inositol in their bodies. So what does inositol do? Inositol basically jumps in and acts as an insulin regulator. So when they start using it, they have more glucose levels in their bloodstream. It
Mm-hmm.
increases progesterone levels. That way, it increases ovulation. It increases serotonin, which is sort of the happiness hormone, and that causes better sleep, better moods. And in the last year that we have put this out in the market, we've had tons of positive reviews of women that are telling us we're sleeping better, our periods are more regular, we're losing the excessive chin hair, we're growing a little bit of new hairs on our head, the hair losses become less, we've lost a bit of weight. So these are the positive effects for the patient.
Wonderful. So, Dr. Pari, the treatment that Elan Healthcare offer for PCOS, is it covered by OHIP or do we need private insurance for this?
Well, unfortunately, like all dietary supplements,
Mm-hmm.
OHIP does not cover them.
Oh, yeah.
It's sort of considered as a vitamin or dietary supplement.
Okay.
Um, but it's like the cost of using ovofolic is less than a coffee a day. And although it maybe not, I can't say it's cheap or affordable for everyone, but it's not so expensive that people can't use it. And we also, what I try to do to help women in the community is that if someone has to use it regularly, we offer a 20% discount on our website for those that want to have a monthly subscription. So that way the cost comes a lot and
Okay,
it
that's
becomes
so
much more
wonderful.
affordable.
That's so good. That's so good. So that's a whole lot of news regarding polycystic ovarian syndrome and the treatment that you have at Elan Healthcare. Dr. Pari, I want to jump to the topic of infertility as well today. Can you
Yes.
give me a brief description of, for those of us who are not aware, like what is infertility and what are the symptoms, what causes it?
Yes. Well, infertility, if we look at the description that the World Health Organization
Mm-hmm.
has mentioned for infertility, it's like if a couple cannot conceive within a year of trying. And
Okay.
recently, because people are getting married at a much later age, even trying to have a baby for the first time after they're 35 years old, many doctors are considering this as a 6-month period. So if a couple is trying to naturally conceive within
Mm-hmm.
the first 6 months and they're not successful, it's recommended that they go to the doctor and explore what's going on.
Okay, so what treatment programs do you offer at Elan Healthcare for infertility?
Again, I don't like to say treatment because
Mm-hmm.
our products are natural health supplements. One of the given facts that everyone agrees on these days is that nutrition has an important role in fertility. and having the proper amounts of nutrients in the body causes a person to have a better conception rate. So that is a given fact. Another given fact is that the World Health Organization and CDC and Health Canada, all of them recommend having a folate and prenatal supplement before conception. So what we have is a prenatal for women, which has a very complete profile of natural vitamins and minerals that a woman needs to take before conception. And this is not for infertility. It's basically anyone that wants to have a healthy conception. It's recommended to have 3 months before pregnancy. And so this is for women, but what is what has been ignored up to now is the male portion, because it's like it takes two to tango. It doesn't happen just on
Yeah.
the mother side. So
Mm-hmm.
we need healthy sperm. And considering that men are also getting married later, there's lots of bad food habits, smoking, if someone uses alcohol, lack of exercise, all of these different factors cause men to have lower sperm health. And
Okay.
our product, which is MedFertile for Men, is the only product in Canada which has approval from Health Canada for sperm cell health. It helps improve the health of the sperm. And that means the motility, the counts, which is very important, both the motility and the counts of the sperm. And again, we consider it as a male prenatal. And it may be a new concept, but again, it has been proven that men also need to take specific vitamins to help their sperm health before pregnancy. So that is also recommended to use 3 months before pregnancy.
Okay, that's wonderful. So that's a whole lot of useful information. And I would say to all those ladies in our community who might be suffering from PCOS or early stages of infertility, to please consult Dr. Pari. She's doing a great job here. Dr. Pari, do you have any message for our community, just for a lifestyle or diet, change to take?
Yes, I think that what is the key factor to reproductive health and also health as a whole, specifically in these times that we are all cooped up at home, many of us are working from home, and I'm also trying to work on this a lot, is
Mm-hmm.
um, a healthy lifestyle, having a healthy, nutritious food balance, and also a exercise regimen. So as I said, I've also been lazy a lot of times in these, because when a person gets busy, it's difficult to work up that specific meal plan, that you don't just grab anything off of the fridge or from takeout, or having an exercise regimen. But even a 20-minute or 30-minute exercise a day, which I've personally started with, like a Zoom class, that I just push my chair back, stand up, do 20 minutes and sit back down and continue with my day. It can be as
Yeah,
simple as that, or taking
exactly.
a little half-hour walk. That is extremely helpful. And also
Mm-hmm.
a balanced diet, which has, all the necessary nutrients that we need for our body.
Mm-hmm. That's wonderful. So where can we find all the information about Elan Healthcare? Can you
Um,
mention the
yes, we do
website?
have a website,
Okay.
which is www.elanhealthcare.ca. And
Mm-hmm.
we also have a Facebook page, an Instagram page that um, the community can follow. And there's always tips and, bits and pieces of information that can be useful. And for
Mm-hmm.
those that are interested to purchase or try out, again, they can reach out. I do have a limited supply of samples that
Okay.
I offer to the community. So we can offer them a few samples, and so they can try it out and then see if it works for them as well.
Okay, wonderful. Thank you so much for joining us,
Thank you.
Dr. Pari. Thank you on
Thank
behalf of
you. It's
Muslim
been a
moms.
pleasure.
Thank you
Thank you
so
so
much.
much.
Thank
Have a great
you.
day. Bye
You
bye.
too. Bye.